To combat the spread of the virus, officials tout the benefits of contact tracing. But public workers tell us that effort has fallen so far behind, it's posing a much larger public health problem. And staffing is just a fraction of what the health department has claimed. Gina Mangieri is always investigating and has details.
People on the inside validate what we have been hearing from survivors and seeing in belated tracing announcements. It can be days or even weeks before any contacts are made, with a relative skeleton crew now overwhelmed by an avalanche of cases. Governor David Ige says a big scale up is now underway at the convention center.
The state's largest public worker union says only 18 specialists and some additional help, not 105 people as the health department testified at the Capitol last week, are on the team charged with tracking who else is at risk from each COVID case. This and other allegations are in a formal grievance HGEA filed with the Department of Health, stating, contrary to what is being communicated to the media by the Department of Health, HGEA is aware of 15 epidemiological specialists on Oahu and 3 on the neighbor islands. Further, the HGEA was made aware that some ESs have been required to perform both COVID-19 field swabbing and outbreak response duties. It is alleged that some employees tasked with these duties have not received or been provided with any official guidelines, protocols, or proper training. Rather, they were simply provided personal protective equipment and directed to go out and swab or to report to positive COVID-19 persons' homes to collect medical specimens. With thousands of active cases, there's no telling what's falling through the cracks with tracing and notification delays. It took the health department 2 weeks to publicly start tracing on August 8th, a gentleman's club case from July 23rd. Another survivor from a gym cluster told us tracing was already nearing a week late, even in early July.
Luckily, I had to make that decision to contact everyone that, and I'm glad I did that because the contact tracers, they didn't get to my friends and family like 5 days later. And I know it's not on them. It's a lot of people, especially now. How the numbers have increased, so it's really tough for them to contact every single person.
HGEA told KHON2 the steady surge may have been mitigated if the Department of Health had brought on additional staff more quickly. They say this is the tip of the iceberg of a much larger public health problem. Governor David Ige sat down with our Manolo Morales today and told him help is on the way.
I have directed the Department of Health to accelerate plans to bring more people on board. We have activated the convention center, and as we speak, we are bringing on board staff. And I would definitely have a more specific number of people that we're able to hire in the next day or so.
This after hundreds of people completed a training program through the University of Hawaii, and after dozens of National Guards people, 25 on Oahu and 12 training for Maui, have jumped in to help with what they call COVID mapping. That's not conducting full tracing, but making phone calls and data entry. Draft plans already on hand submitted to the Department of Defense outline various tracing scale-up models and personnel options. But the Department of Defense tells me none of those are viable immediately, and that they have no near-term plans to surge up tracing, take over, or do things differently, telling me that is up to the Department of Health. If they need numbers of personnel to assist, they ask. National Guard personnel will assist Hawaii Department of Health when requested. The Department of Health told KHON2 this afternoon that there are more than 105 contact tracers working statewide as of this week, and the department is taking action on the union's concerns. Gina Mangieri, KHON2 News, always investigating.